do this. So today we're going to identify the common causes of allergic reactions. We're going to identify common signs, symptoms of allergic reactions, identify treatment of allergic reactions, state the relationship to airway management when it comes to allergic reactions. We're going to state state protocols and for use of the epi injector and correctly use an EpiPen. So here's why this is so important. So at least 1,000 Americans per year die of allergic reactions. That number is way higher than that now. This is an old number. So just think about that for a minute, though. We can actually stop an allergic reaction in its tracks and reverse it by the treatments we give. So we can actually help that number. A little terminology. Immunology is a study of the body's immune system. So let's review. Let's talk about some anatomy and physiology. Because the immune system protects the body against foreign substances and organisms. When foreign substances invade the body initiates a series of responses and inactivate the invader. Sometimes the body becomes very confused of what they're going to do with that. So this releases chemicals to combat that stimulus. This includes histamines and leukotrienes. So with histamine, the histamine's reaction in the body does this. This causes the contraction of smooth muscles in the tissues in the lungs, in the uterus, and in the stomach. So think about what that means. Well, we'll talk more about it, but think about what that means. So if the tissues are contracting in the lungs, the muscles are contracting in the lungs, they're shrinking the lungs and the airways, the uterus and the stomach. So when that happens in the stomach, that causes GI distress, an emptying of the stomach. And in the uterus, it can cause cramping and undue pain, and also it can cause hypotension. So it causes stimulation of gastric acid secretions because it wants to empty the stomach, because it thinks something is harmful in the stomach. This increases permeability and it decreases blood pressure by doing this, so by dilation of the blood vessels. So in histamine in the periphery, in the body, in the arms, in the legs, in the skin, it actually causes major vasodilation. So the blood starts to pool, and it increases permeability of the cells. So that actually causes leakage of fluids into the interstitial spaces of the cells and then into the through the cellular walls. Leukotriene's reaction in the body does this. So this is an inflammatory molecule. And what it does, it's primarily responsible for bronchoconstriction in your lungs. Bronchoconstriction, remember, it's going to shrink the lungs and basically close your lungs because the body's trying to protect itself from whatever it's inhaling. So in the pathophysiology of it, what's happening? It's allergic reaction exaggerated by the immune response to any substance. This may be mild, local, severe, and symptomatic. Think about that. Severe and symptomatic. It happens quickly, so we have to respond quickly. Just a moment. There you go. When you're done, when your laughing dies down, you can continue. All right. So the medications we use. Now we look at this guy that we're looking at, full of hives, full of allergic reaction. So a penicillin injection may cause immediate and severe reaction. It looks something like this. This is a full body And think about all that reddening, those hives that you're seeing, and that skin reaction is blood that is leaking through all those interstitial spaces and causing welts in your body's response. Oral penicillin could actually take longer. This goes for anything when it comes to whatever's causing this reaction. It could be penicillin, but it could be another medication. It could be a bee sting. It could be anything else. Injection's going to happen, could happen immediately, and it could be severe really quickly. But anything that's ingested through your stomach could take longer, and it could have different symptoms with the GI symptoms too, top of everything else. They typically experience an allergic reaction after becoming sensitized. After becoming sensitized. So sensitized means that they've been exposed and didn't really have a reaction, but their body said, "What was that?" And it has responded to it. Now it's become sensitized to it. So next time it sees it, now it's going to rock and roll. Something has to happen. I'm going to fix this. So pathophysiology, this is extreme life-threatening allergic reaction is anaphylaxis. Anaphylaxis. Extreme and life-threatening. This is a full body reaction to something. This involves multiple organ systems. So when I say full body, I'm not kidding. Wheezing is one of the most common signs we see with anaphylaxis. But it's not just wheezing, it's so much more. But what we're going to do, the signs and symptoms, we're going to look at it, the wheezing we're seeing with shortness of breath, increased work of breathing. So we have that tripoding kid, of course, right? That shortness of breath. Could be rapid, labored, noisy breathing. Kid could be hoarse because his throat's closing. And remember when we talked about respiratory in adults and in kids, we talk about that increased work of breathing and those accessory muscles. So you're looking on the picture of the child, you actually see his ribs coming up as he's taking breaths because he's trying to get air in, and there's so much negative pressure in his chest as he breathes, trying to get air in. It sucks in the tissue around his ribs. So in kids with increased work of breathing, you'll see a head bobbing in babies. So the head bobbing is actually, they're using all of their muscles. They're using their stomach muscles, and they're using all their neck muscles, and they're using their chest muscles. It makes their head go up and down as they're breathing. They're going to be grunting. Grunting is how children and some adults increase the pressure that they exhale against, because when they do that increased pressure tries to pop the lungs open and the alveoli open so they can exchange the gases, being the oxygen and carbon dioxide in the alveoli. But they have to be popped open so that can actually exchange. So grunting is your body's way of increasing that pressure as we exhale to keep those open. So you're going to see in some people and we talked about this before, just review, lip pursing. That also is increasing that pressure as person exhales. They're unable to speak in full sentences. This is a ding, ding, ding. Somebody's having severe respiratory distress. This is an issue. So when you talk to somebody and you listen closely, if they're only able to talk in just a couple of words at a time because they have to get a breath, then that is an indication of severe, going to happen right now, respiratory distress. We need to address that before it becomes respiratory failure. Then we have wheezing. This is one of the things we have with wheezing. So wheezing happens when we exhale. So when we exhale, if you think about one of the causes of that histamine, it causes the bronchoconstriction. As that bronchoconstriction happens, as we increase the pressure in our chest to breathe out, it actually puts pressure on those passageways, And as we breathe out, we actually whistle through those passageways. So you'll hear that wheezing. So when it's bad enough and as it progresses, it goes from both expiratory and inspiratory. When you start to have inspiratory wheezing, you may not even hear any expiratory noises. That's ominous. That's gonna be bad. The bad is gonna be happening soon. And that may progress to that silent trest. So when we talk about the silent chest, we talked about the lower airway. We also involve the upper airway. So when we have that silent chest, we also might be having edema around the laryngeal edema that's around the glottic opening, and actually in the throat, it actually is going to start closing that part of the airway down, so a person can't even bring air in at all. Silent chest goes with that. Not moving even enough air to move to make a noise. So this can progress quickly to apnea. Yes, it's a cute picture. Yes. Save him. Save the squirrel. All right. So other signs we're going to look for. This could be life-threatening, but this could also just be a sign. And this is you're having an allergic reaction. We're going to watch you closely. That we're going to, before bad things start happening. This is called hives. There's called urticaria. And this could progress very quickly because remember, it's taking fluids to make the skin look this way. And a person actually can quickly become hypotensive because of this, especially children. So just how you see it, pale and reddening and regular, just raised, elevated patches of skin. Very, very obvious when you see them. So, and it's very itching. It itches, it burns. So one of the things, which is a form of a histamine release, and it also is very, very common. You're not necessarily meaning you're having a huge allergic reaction. One of the things you'll talk about when you talk about the tox side of things is poison ivy or poison oak. The contact with those oils in those can make you have these raised reactions of these blisters that actually is a histamine reaction that's causing that. So just FYI, think of everything that could possibly cause this when you go and see something like that, and protect yourself, for crying out loud. So there you go. Pretty good examples of what we're seeing. So those are hives, urticaria. So swelling, when we start to be concerned, we're going to have the angioedema, the edema in the face, in the airway, in the mouth, in the tongue, in the back of the airway. Be concerned. Be concerned. So in the beginning of this, you might not see this. And I always ask my patients if they've called because they think they're having an allergic reaction to something. One of my first things I ask them, if I don't readily see anything, is do you feel like your tongue is swelling, and do you feel like you have closing in your throat? You're not really supposed to ask leading questions, but sometimes people don't even notice that until you say it. But they may describe, my tongue feels like it's fat, or they may feel like my throat, and just they have that a little cough, that cough, because the body's response to this is that cough and that swelling. So if you see that, could quickly progress into a very severe anaphylaxis reaction that could be life-threatening. So be aware. So signs of complaint of is that fat tongue, that and the tightness in the throat. We also have tightness in their chest when that happens. When you take their vital signs, you'll find that they might be tachycardic with a fast heart rate over 100 or higher, depending what it is. But remember, part of this too is scary. So that also can increase the heart rate. But boy, when they have the urticaria, they're going to be itching. It is very, very uncomfortable for them to have. And then when it starts to progress down this pathway, because of that distributive shock, that happens because of all that blood pooling and that vasodilation and that leaking through the blood vessels, they can become hypotensive to the point that that is life-threatening. So we need to identify this. And when they start getting down that pathway, they're going to be like, oh my God, I think I'm going to die. They have this sense of something horrible is happening to me. I am going to die. That sense of impending doom that's happening. So when you take care of a anaphylaxis patient or even allergic patient or allergic reaction patient, ask them these things. What are you allergic to? Do you know? Because they might not be allergic, might be their first time. What were you exposed to? Did you eat peanuts? Did you inhale something? Whatever they were allergic to. I just started a prescription for a medication, and I took a dose, and the next day I took another dose, and I had an immediate reaction. They built a sensitivity just with that first dose. Never took it before. And how were they exposed? Was it injection through the skin? Was it inhalation? Did they ingest it? Did it absorb through the skin? What are the signs and symptoms do they have? Remember, you can see some stuff. You can see respiratory distress. You can see urticaria. You can see pale diaphoretic skin. You can see that stuff, but you got to ask, what symptoms are you having? And then once you started those symptoms, what were you doing when it started? What was the first symptom that came on? And then how did it progress? What happened next? Did it progressively worsen since that time? And have you done any interventions? Did you take your EpiPen? Did you take Benadryl? What did you do this time that you didn't do last time? Anything like that. So interventions they did, because if they did do epinephrine, that's a ding, ding, ding moment. We need to be on the lookout for this, for improvement from that epinephrine if it just happened, or we got to look for those signs that happen with epinephrine, which could be tachycardia and hypertension and everything that goes with it. But that's why it's important, if we're going to be doing that, we need to have ALS on the way to our call too. So, all right. Now, what do you document? Well, there you go. You document this stuff, the stuff you asked. Now you document it. So we're gonna document the substance. How long ago it happened? Initial symptoms that were reported and how did it progress? Time and dose of epinephrine that they delivered, but also if you gave epinephrine. What time did you do it and how much was it? And the name of the individual administering the epinephrine. So if you are doing it, your name goes on that chart. Otherwise, describe the patient self-administered it. And did they respond to it? Did they improve? Did they worsen? Or did they not have anything at all? All right. Oh, I love it. I guess we'll move on. So just to describe what you were about to see here was a clip from The Big Bang Theory, when one of the cast members had an allergic reaction because he purposely ate a peanut granola bar that he knew he was allergic to. Took one for the team. So, all right. This meets all of us. I think we all have fallen under this category at one time or another, but let's look at our protocols. All right. So when we are taking care of our patients, we're going to put them in a position of comfort. We're going to do airway management. We're going to do it aggressively, and we're going to do appropriate O2 therapy. If it's severe respiratory distress, or they have facial or oral edema, and they're hypoperfusing, meaning they have a low blood pressure and they have the signs that go with it, do not hesitate. Pull out the EpiPen, the Epi auto injector, which an adult dose for that is 0.3 milligrams intramuscular, and a pediatric dose that is less than 30 kilograms is 0.15 milligrams IM. Do not hesitate. This is a life-saving moment. So, history of anaphylaxis with exposure to developing respiratory distress and or a rash. So if they have a history of it and they're having a respiratory distress and a rash, give the Epi. You can repeat that Epi in 5 minutes if there's no improvement. Wait the 5 minutes. Remember, there's anxiety that goes with this for the patient. Also for you, if you've never done it before, take a minute, mark down what time you did it, wait the 5 minutes. In that 5 minute time, reassess your patient often. Is there respiratory distress because of anxiety? You'll know that by watching their pulse oximetry and watching their vital signs. Work to calm your patient while this is going on, so you get a good, solid indication of improvement, and not to be confused with the anxiety they may be having. If a person's truly in respiratory distress and you give them epi and they start to improve, usually their anxiety improves with it, because it's scary. Is one of the scariest things is in respiratory distress. So, and then if agency approved, is we could do syringe epi, which is an entirely other class that will be done by your specific New York State agency that you're working with. So, but syringe epi can be substituted for the auto injector, which is same dosing. It's just you're giving it through a significantly less expensive syringe with a significantly less expensive medication as an IM injection. So if your patient is wheezing, we're going to give albuterol 2.5 milligrams and 3 mLs via nebulizer. And we can repeat this three times. So remember, when we are giving this is very similar to what we would give for asthma, but epinephrine comes first. Epinephrine comes first. Epi can also be used for asthma with a physician's order if you're going to be doing that. All right, so we're going to give epinephrine. This is when are we going to do it and how are we going to do it? Notice how this patient's thumb, please make sure you bare skin before you do it. This is a great picture of a lay person that doesn't have health training or EMT training. This is how they might do it. However, bare the skin. That's a great way to how a contaminant can enter through the skin. So bare the skin when you do it. But we'll talk more about that in a minute. But notice how the thumb is taut. It's not sitting on top, because if they were to have this upside down, they could possibly inject right into that thumb. So indications, signs of an allergic reaction. So what we're going to do with epinephrine, we got to look at the actions of this is what to expect when it happens. So this mimics sympathetic, the fight or flight response. So remember, you're on a roller coaster and you're scared and you have that response. That's your body's hormone of epinephrine and norepinephrine, and that's what that does. It's a vasoconstrictor. So remember that dilation is caused in your blood vessels by the histamine. This is actually going to constrict it. It's very powerful to do that. And it's going to cause all that constriction that's happening in your bronchioles. It's going to cause it to dilate. So epinephrine rate, dose, and route. This is what we have. We have an adult dose is 0.3 milligrams via auto injector. It is, you give that IM. Okay. So take a second and watch. This is actually, this guy's great. If you ever get a chance and you just want to look out of his skills, I want to know how to put a traction splint on. This guy does the best little flash videos.
This right here is an EpiPen. I'm going to show you how to use it. So first, the needle end, the orange end, we're going to twist this off and get rid of it. The blue cap comes off, so we push that off like this. Now the device is live. So patient's outer thigh, and all the muscle there. We're going to forcefully press and push into that thigh, delivering the drug. Just follow my page here. I go over all of it.
Thank you, paramedic coach. He does awesome videos. So just a great resource for you to use.
This right here.
Yeah, we got it. All right. So when you're doing it, you're gonna administer on the lateral thigh. So remember anatomical position. So you have towards the outside, that's lateral. Towards the inside, that's medial. So on the lateral thigh, just like you see in a picture there. So, and that's where you do it. Big, huge muscle to go in. You're going to go in there. So What side effects are we gonna see with this? Remember what happens when you have that fight or flight, that effect that you see. So you're gonna have tachycardia, you're gonna be racing with that. Your skin could have weird pallor. You're gonna have excitability, your heart's gonna be racing, your blood pressure could go up too. And the other side effects you could have, you could become dizzy with this. And a headache, which I just passed right through, sorry about that. Become dizzy with that. You could have cardiac arrhythmias. I have, not personally, I have seen and heard different horror stories of older individuals with heart problems having epinephrine and going and causing them to go into VTAC and all sorts of horrible arrhythmias. However, they lived because they survived the anaphylactic reaction. They took care of the VTAC and the epinephrine was out of the system and that resolved. So they could have chest pain, they could have nausea, they could have vomiting to go along with it. So think about in the different situations that we're going to look at here. Would you or wouldn't you? So but king size Snicker bars are the best. Anyway, so think about it. Here's your patient, what she looks like from the door. So she's 15 years old. She's at summer camp and she was stung by an unknown insect on her cheek. Could have been a bee, it could have been a spider, we don't know. This is what she presented to you from the door. So 30 minutes later, she walked into your infirmary. Hi, is this abnormal? Weird, right? So she has an epinephrine auto-injector for bee stings. The pain is local, and she can't open her right eye. Her vital signs are this. Her respirations are 24. Her heart rate is 96. Her blood pressure is good. At 132/64, you listen to her lungs and they're clear. Would you give epinephrine to her? If you would, why? Think about that for a minute. If you wouldn't, why? Think about that for a minute. So I wouldn't give her epinephrine because of her vital signs and the localized area that it's only affecting. She's not having a full body reaction to this because she just has a local swelling right there. Does it look horrible? Yes. Yes, it does. All right. This guy, 79-year-old woman. She's allergic to shellfish. She went to a dinner at a restaurant. She doesn't think she was exposed. She developed hives all over her face, her cheek, and her chest and her back. She took some Benadryl because of the hives. She called the EMS after she started to get short of breath. And when they got there, they found this. Respiratory rate was 26, so she's pretty she's starting to get tachypnic. Heart rate's kind of fast at 106 over, or I'm sorry, at 106 BP. It's kind of soft at 102/52. Listen to her lungs. You hear wheezing, shallow retractions at the neck, and intercostal space, in the intercostal spaces. Would you give epinephrine for this patient? If you would, why? If you wouldn't, why? So she progressed from, I have hives that progressed. I took Benadryl and it continued to progress. And just FYI, Benadryl is a histamine blocker. So that what that's doing is the histamine that's interacting with those cells that's causing vasodilation, it causes the constriction. It actually blocks those cell receptors that the histamine interact with. So when it blocks them, it says, stop, you can't go in there and not let that progress. But if the damage is already done before that happens, or she took it by mouth, it might be just sitting in her stomach and it won't absorb because of all the other stuff that's happening in this aspect. So her vital signs, she's starting to probably go down that route of full anaphylaxis. But the concerning part of her is the lungs. So she's wheezing, she has retractions, she has distress because of this. So yeah, this is developing into something significant. She's short of breath. She has a known allergy to shellfish. She's in a restaurant. So just assume this is what's happening and give her epinephrine. Excuse me, don't mean to cough on camera. All right, look at this patient. So this patient is a 3-year-old girl. She was nauseous after eating strawberries at a family picnic. 15 minutes later, she had a rash around her mouth. She was pale and she was lethargic. She's now unresponsive. Her vitals are this. Sure, she's 3. She has a 3-year-old with a respiratory rate of 12. Heart rate is 64. Capillary refill is less than 4 seconds. This is one sick kid that is progressing quickly. So remember, somebody that has an allergic reaction and they have GI symptoms to start, consider it an allergic reaction. If you have somebody that has nausea or vomiting and they said it just started suddenly after a few hours after or a few minutes after eating, think allergic reaction, because that could be where this starts. So she also had a rash around her mouth. She became pale and lethargic because her blood pressure and vital signs were starting to crap the bed. So her respiratory rate is 12. She needs to be, you probably need to ventilate her to get that heart rate. Hopefully that'll come up with ventilation, but be ready to start compressions. That capillary refill is horrible. So when you listen to it, her lungs are nearly absent. They're faint, and you hear really faint wheezes. That's because you're almost to a silent chest. All right, so that's epi quickly. She will respond very quickly with that. Kids do. It's actually pretty amazing to watch when you have an anaphylactic kid that you give epi to and watch how quick they come around. So Hymenoptera stings. I said that 6 times fast. So bees, wasps, ants, yellow jackets, and if you spend more than two days outside in your life, you probably have been bitten by something or stung by something. I've been torn up by bees so many times I can't. Thank God I'm not allergic. I'd be dead right now. So insect stings. Think about what bees and hornets do. So honeybees and bumblebees, all those guys, they can't withdraw their stinger because it's barbed. So to protect what they're supposed to protect, they will sting you, and then they'll fly away, and their stinger and will just stay in you. They'll go and die. But it can continue to inject venom for 20 more minutes. Think about that. So you need to get that out of there. But we'll talk about how to do that. So what we need to do, we're gonna try to remove that stinger. Well, you will remove it. I haven't failed yet. Remove the stinger by scraping with the edge of a sharp, stiff object like a credit card or a piece of cardboard, something like that. What you don't want to do, you don't want to take a tweezers and pick it up or use your fingers, because you can actually squeeze it and inject more into the person's body, and that's not good. So what are we going to do? Do not use it tweezers or forceps. Use that card technique. Wash the area with soap and water. Remove any jewelry from the area, because expect swelling, because it will happen. Be alert for vomiting and signs of shock. That would be a good indication that they're going to anaphylaxis, past the allergic reaction. If you need it, give oxygen. Monitor the vital signs. Monitor often, because that's how anaphylaxis works. Somebody will be looking at me going, oh man, that's really painful. Boy, those bees are really horrible. And the next minute they're short of breath and their blood pressure's in the tank. And you're like, what the heck just happened? All right, so that's really quick. Questions on that? Make sure you review other sources that you do, since you're looking at a video right now. Of course, if you're in my class, I'm here as a resource, but so are your instructors and other paramedics and EMTs you may encounter. So, all right, let's take some time to do some review. All right, the signs and symptoms of allergic reaction are caused by the release of what? Nice work, because it is histamine. The negative effects associated with anaphylactic shock are the result of. Good job. Vasoconstriction and bronchoconstriction. Those are the ones that get you quickly. All right. You're called to the local baseball park for a 23-year-old man with difficulty breathing. He states that he ate a package of peanuts 30 minutes ago and denies any allergies or past medical history. Your assessment reveals widespread urticaria, tachycardia, and a BP of 90/60. You hear him wheezing even without a stethoscope. You should be most suspicious of a or an what? Well, because we're talking about allergies today, and you said severe allergic reaction, by all means, you're right. All right. You are treating a woman who was stung numerous times by hornets. On assessment, you note that some of her stingers are still embedded in her skin. You should, that's right, scrape them from her skin. All right. A young male is experiencing signs and symptoms of anaphylactic shock after being stung by a scorpion. His level of consciousness is diminished. His breathing is severely labored. You can hear inspiratory stridor and his face is cyanotic. The patient is prescribed epinephrine autoinjector. What should you do first? Be careful when you answer. He has a diminished level of consciousness. So his breathing is labored. You can hear stridor. His face is cyanotic. So he's pretty hypoxic. So provide ventilatory assistance with BVM if you have to. And then hopefully you can get him his epi on board. So the most reliable indicator of upper airway swelling during severe allergic reaction is stridor. Let's actually back up for a minute. This patient too would be, yeah, you can rock and roll, especially if you work for an agency that you are epi approved. Provide ventilatory system with BVM and give epi all at the same time. There you go. Stridor. If you said that, that's because you're smart. There you go. The best tool or method for assessing a patient's perfusion status is a pulse oximetry. Make sure you know where it is and how to use it. Adult EpiPen delivers blank milligrams of epinephrine, and the infant child delivers blank milligrams. You said B, you are correct. When administering epinephrine via autoinjector, the EMT should hold the injector in place for, you'll see all sorts of different verbiage on this. It's anywhere from 3 to 15 seconds. Do 10 seconds. That's going to get you what you need to go. So, all right. The chemical released into the body during an allergic reaction is called, what is that chemical that causes that bronchoconstriction and that vasodilation? Or it's called histamine. What is the definitive treatment for severe allergic reaction? If you haven't picked it up yet, give the epi. Give the epi. All right. Any questions? Please refer to who your instructors are, or me, or an EMT, or a paramedic. They will hook you up. All right, let's stop.